If you look at the treatment overview by stage, essentially, we break this up by stage one, two, and three being curable, and stage four being not curable as well too. Localized stage one and two are typically managed by something called a partial or a radical nephrectomy. And I'll talk about the differences between those two. Locally advanced cancers are typically considered to be stage three cancers, and they involve surgery plus or minus systemic therapy with Keytruda and immune treatment being the more commonly or only FDA approved treatment at this point in time as well too. And then those that are stage four, we essentially talk about using immunotherapy, which is administered in an IV typically or through a port. We talk about TKIs, which are pills that help stop blood vessel growth of kidney cancers. We know kidney cancers to be very blood vessel heavy in terms of how they grow and spread as well too. And these pills essentially help stop that growth and essentially stop blood flow or stop blood vessel growth as well too. And then combinations between these two as well too. And then many times active surveillance or where we are monitoring with CAT scans may be appropriate for smaller tumors for patients that are older or have many other medical problems that they do not want to do a surgery or do any sort of treatment at this point in time right now. And then after surgery or folks that have a stage one or stage two or stage three cancer, typically we are getting CAT scans or MRIs, typically every few months as outlined here. And that will vary depending on the stage of your cancer. The higher the stage, the more frequently we'll want to observe or get a CAT scan to watch and make sure there's no recurrence of cancer. Whereas if closer to stage one, we only typically get CAT scans every 6 to 12 months and then annually potentially after that. But we will still do blood work and urine analyses as well too to monitor for other signs or symptoms of recurrence as well too.